Have you ever felt like the world is closing in on you? Like your heart is pounding out of your chest and you can't catch your breath? If so, you may be experiencing panic attacks. Panic attacks are a common and treatable mental health condition that affects millions of people around the world. But despite their prevalence, many people are still unaware of the symptoms and causes of panic attacks. That's why we've created this video, to help educate and raise awareness about this important issue. In this video, we'll explore the causes and symptoms of panic attacks, and provide practical tips and tools for managing and coping with this condition. But most importantly, we want to let you know that you're not alone. Welcome to Meducatives. This is the official YouTube channel of www.meducatives.com. We believe that awareness is everything, and our goal is to promote it. Panic attacks can be scary and overwhelming, but with the right support and resources, you can learn to manage your symptoms and live a full and happy life. Panic attacks are intense and sudden feelings of fear or terror that can occur without warning. Symptoms of a panic attack can include rapid heart rate, sweating, trembling, shortness of breath, chest pain, nausea, dizziness, and feelings of unreality or detachment. Panic attacks can be very distressing and can interfere with daily activities and quality of life. Causes of panic attacks. The exact cause of panic attacks is unknown, but they are often triggered by stress, life changes, and traumatic events. Some people may have a genetic predisposition to panic attacks or may be more sensitive to stress and anxiety. Treatment techniques. Panic attacks can be treated with a combination of medication and therapy. Some common treatment techniques include the 3-3-3 rule panic disorder. The 3-3-3 rule is a technique that some people find helpful in managing the symptoms of panic attacks associated with panic disorder. The rule is as follows. Look around you and name 3 things you can see. Listen carefully and name 3 things you can hear. Move your body and do 3 different movements. The idea behind this rule is to help distract your mind from the panic attack by focusing on your surroundings and getting your body moving. By engaging your senses and focusing on the present moment, it can help reduce the intensity and duration of the panic attack. However, it's important to note that different strategies work for different people, and this technique may not work for everyone. If you have panic disorder, it's important to work with a mental health professional to develop a personalized treatment plan that works for you. There are some other techniques. If you integrate these techniques with 333 rule, they can be more effective. Deep breathing. Take a deep breath in for 3 seconds, hold for 3 seconds, and then exhale for 3 seconds. Repeat this pattern for several minutes until you feel more relaxed. You can combine this technique with the 333 rule by focusing on your breath as you count to 3 during each inhale, hold, and exhale. Progressive muscle relaxation. Sit or lie down in a comfortable position and start by tensing your toes for a few seconds, then relax them. Move up your body, tensing and then relaxing your calves, thighs, buttocks, stomach, chest, arms, hands, shoulders, neck, and face. You can combine this technique with the 333 rule by doing 3 sets of tensing and relaxing for each muscle group. Mindfulness meditation. Find a quiet place to sit and focus on your breath. As you inhale, count to 3, then hold for 3 seconds, and exhale for 3 seconds. If your mind wanders, gently bring your attention back to your breath. You can combine this technique with the 333 rule by focusing on your breath, the sounds around you, and the sensations in your body as you count to 3 during each inhale, hold, and exhale. Cognitive restructuring. When negative thoughts arise, challenge them with evidence-based reasoning. For example, if you're thinking, "I'm going to die," during a panic attack, challenge that thought by reminding yourself that you've had panic attacks before and you've always survived. You can combine this technique with the 333 rule by challenging each negative thought with 3 pieces of evidence-based reasoning. Exposure therapy. Start by exposing yourself to something that triggers mild anxiety, such as looking at a picture of a spider. Stay with the anxiety until it subsides, and then repeat the exposure until your anxiety reduces. Gradually increase the intensity of the exposure over time. You can combine this technique with the 333 rule by using it as a grounding technique to stay present during the exposure. For example, you might look at the spider picture for 3 seconds, listen to 3 sounds around you, and then touch 3 different objects in the room. Tips for coping with panic attacks. In addition to treatment techniques, there are some tips that can help you cope with panic attacks. 1. Practice self-care. Make sure you are getting enough sleep, exercise, and healthy food. Taking care of your physical health can help reduce symptoms of anxiety. 2. Identify triggers. Try to identify what triggers your panic attacks and avoid those triggers if possible. For example, if you know that being in crowded spaces triggers your panic attacks, try to avoid crowded spaces as much as possible. 3. Practice mindfulness. Focus on the present moment and try to stay present with your sensations and emotions. This can help reduce feelings of anxiety. 4. Use coping statements. Create positive statements that you can repeat to yourself during a panic attack, such as, "I can handle this," or, "This feeling will pass." 5. Seek support. Reach out to friends, family, or a mental health professional for support. Talking about your feelings and experiences can be very helpful in reducing symptoms of anxiety. Overall, panic attacks can be very distressing, but with the right treatment techniques and coping strategies, it is possible to manage symptoms and improve quality of life. If you are experiencing panic attacks, it's important to reach out to a mental health professional for help. Thanks for watching. Please visit our website, www.medukatives.com. You may like our free ebooks and medical and health educational products on our website. If you enjoyed the video, please consider subscribing, sharing, liking, commenting, and pressing the bell icon to receive notifications for more content like this. Lastly, don't forget to follow us on Instagram, Facebook, and Twitter.